Hi everyone, so thank you Denise for that. For those of you that don't know about SafeCare BC is the Health and Safety Association that's industry funded to do prevention initiatives and health and safety education to help employers with workplace injuries. We represent over 830 employers across the province and 29,000 continuing care workers. So I want to start off by introducing the group to Pam. We've heard a lot about numbers today and stats. Pam is a healthcare aide who is working in Abbotsford. She is a face behind one of those 600 FTEs that was off work due to a workplace injury. She was helping a resident using a sit-stand lift, and the lift broke. She felt a sharp pain in her knee, and she suffered a major injury. Pam went through over a year of rehab and was told she needed to have a full knee replacement surgery. She then learned that she would never return to the sector, and she would not be able to work as a healthcare aide ever again. She was devastated. This was something that she loved to do. She was very passionate about seniors care, and she's just one example of a skilled worker that we lost due to a workplace injury. So I'm here to talk about the numbers behind workplace injuries in our sector, and to speak a little bit to prevention initiatives that might help keep people like Pam working in the sector today. Prevention of workplace injuries is one way that we can increase staff retention. A focus on safety culture can move the focus towards keeping people in the sector to prevent these injuries. Safety culture influences what people see, what they feel, what they hear, and it very much drives the actions behind their decisions. Safety culture includes things like communication, leadership, priority given to safety, and education and training. A positive safety culture focuses on partnerships, includes safety as a priority, as part of organizational strategy, and emphasizes a commitment towards continuous improvement. Many studies on safety culture have shown that the most challenging aspects of building a company-wide safety culture is making sure that employees feel comfortable in reporting hazards, making sure that they feel comfortable making safety suggestions, and that they get a chance to participate in hazard identification. I thought we could spend a few minutes today looking at other sectors and some of our colleagues' workplaces to learn about how they've improved safety culture with the hopes of focusing on prevention. So looking at industries such as the military and aerospace, who are known for their ability to deal with risky processes, one important driver of safety is an explicit commitment from leadership to health and safety. They focus on a system improvement by learning from errors rather than blaming individuals for their mistakes. So this concept was applied in a hospital study where executives walked around and they were able to provide feedback and ask questions to the people working in the hospital about near misses, anything that could be done to improve patient safety, and what specific interventions leadership could make to make the work environment safer. We thought that perhaps a similar approach could be taken to apply to worker safety, where leadership walks around and talks to staff about what types of issues they might be facing when they're dealing with residents when it comes to mental health issues, for example. This could be a promising tool for our sector and something that we could definitely learn from. Making staff safety a priority during hiring also improves safety culture. This influences a positive safety culture and demonstrates an organization's commitment to safety. There's an opportunity to set the tone during the hiring process to show applicants your commitment to health and safety, as well as assess a potential hire for their safety mindedness. So you can use things like behavioral-based questions when you're doing an interview. An example is, provide an example when you took extra time to make sure that your staff, your colleague, and your patient were safe when you were carrying out a task. Speaking to your organizational values during an interview helps you set out expectations early on. Industries such as oil and gas have used this type of practice for hiring as well as performance evaluations, and they typically perform better when it comes to workplace health and safety injuries compared to the healthcare sector, despite having a high-risk profile. The last thing I wanted to talk about is education. Education improves safety culture. Investing in the education of your staff helps promote a positive safety culture because it helps staff in identifying problems before they become an injury. Training can't be a one-off event. It needs to have follow-up and regular communication to reinforce best practices. The oil and gas sector has decided it's not good enough to just train on the job. They make sure that employees coming in have had health and safety education before they even step onto a work site. Looking at your organization's approach to health and safety and education around that could be one way to evaluate the effectiveness of your program. Collectively, we want more people in the sector and we want them to stay in the sector. Focusing on a positive safety culture ensures that health and safety becomes part of everything that we do. Leadership commitment motivates staff to work safely. It provides them with the resources and skills to do so. Giving staff safety a priority demonstrates the common thread of safety through an organizational practices. Education and training shows the commitment to physical safety and the psychological well-being of your workers. Together, these factors can lead to a reduction in injury rate and a retention of staff. Moving into this afternoon's workshop, let's start to think about what your primary health and safety issues are, if we're doing enough to minimize the factors that create health and safety risks, and focus on new approaches and solutions that we can easily implement to improve the overall culture of the sector.